Under the guise of compassion, we have a plan that's got a lot of questionable language that the Democrats cannot even sign on to. A lot of rough estimates at cost, which usually are underestimates to sell a program. According to the CBO and Obama, he seems content to tackle the immigration issue next year, where we're all debating, who gets covered and how these things get paid for. It seems backwards to me when you don't know the numbers that go into the equation for how much it's going to cost. No one is opposed to reform. The people that are turning out to these town hall meetings have read the bill. They have heard discussions about what a government takeover could mean to them. We already have to wait for appointments to see doctors. It's the simple rule of supply and demand that frightens the people. If the government takes over our healthcare system, we will be subjected to a system similar to the VA plan, which I know a lot of people out of this gentleman here, does not go to the VA for his healthcare, and he's a veteran. That's why this discussion is so hot. 80% of the people are happy with their insurance. It's more reasonable to allow for competition across state borders. It's more reasonable to cut out waste and fraud. It's more sensible to work on tort reform, which has already been debated, and antitrust reform. National security is the issue when we have porous borders. And when an illegal immigrant starts tapping into our services, it's taking away from the services that are available for the legal citizens of this country. And the immigrants who came here legally, they're not playing by the rules, and it's a simple issue of breaking the law, not compassion. Regarding your comment on taxpayer-funded abortion last night not being in the bill, the National Right to Life Committee is opposed to the provisions of this bill as written. On July 30th, Representative Lewis Capps, Democrat from California, introduced H.R. 3200 that would specifically include abortion in the health care legislation, solidifying the radical pro-abortion nature of this bill. The Capps measure would include both abortion coverage and funding in the public option and the private plans. That would be part of the bill's exchange provision. Americans would be required to have health care that meets minimum standards, and the Obama administration considers abortion an essential service. It doesn't matter which side of the fence you are about abortion. I'm talking about taxpayer-funded abortion. We have to pay for it, okay, whether we agree with it or not. After Representative Bart Stupak, Democrat from Michigan, and Representative Joe Pitt, Republican from Pennsylvania, added an amendment to prevent mandatory abortion coverage, Chairman Henry Waxman, Democrat from California, called for a revote, and Tennessee Democrat Bart Gordon switched his vote to the pro-abortion side. Congressman Rothman, 71% of Americans, according to a recent polling data, are opposed to legislation requiring insurers to cover abortion. So the House legislation is completely at odds with the will of those who they claim to represent. And again, I want to add thank you for coming and listening to us, because some congressmen and senators think they're doing us a favor by listening to us, like all inspector.
All inspector. I've heard a lot of trouble about that.
To strip abortion from the bill have been voted down. My question is, what is your position on taxpayer-funded abortion, which will increase the death of preborn infants by 30%?
Gentlelady and I read the bill differently. The bill prohibits federal funds used for abortion. And if you're unsatisfied, if anyone is unsatisfied that the language is unclear, then we should make it more clear, because that was the intention, to have no federal funds to use for abortion, period. Now, on the subject of whether a health care plan would have to provide abortion,
Do you have email?
or the right for a person to choose a health insurance policy which would provide an abortion not federally funded, the drafts as they are presently situated say the following, roughly, that one plan at least has to be available in the exchange where a person, if they choose, can pay a premium to have a plan that will allow them to have an abortion under the law, whatever the law says, and would have to have at least one plan that would not provide abortion at all, period. And then whatever the private insurance carriers want to do with the other plans, they can. But no federal funds are to be used for abortions under any plan or any part of these bills.
The language, I'm sorry, the pro-abortion language is not straightforward in the bill deliberately, and it's crafted with references to family planning, outpatient services, and physician services. But the bottom line is, without specific exemption.
Well, let's do it. Let's make a specific exemption, because
That's your position?
Yes. And
Okay.
I told you
Thank
what
you.
I believe the intention was, and my position is, if the language is inartfully done or ambiguous intentionally or otherwise, let's make it absolutely crystal clear in your mind or any other reasonable person's mind.
I just tend to not trust that unless it's in the bill specifically because
Well, it is in the bill.
Obama
but you
wants
don't
to
think
pass
it's-
the Freedom of Choice Act. He said that that was his
But
priority.
that is not in the bill. What is in the bill is what I said. And let's work together, if you wish, be happy to work with you, to make sure that the language meets your satisfaction, that it's that what I said it's going to do is all that it will do, nothing more.
Great, thank you.
Okay, thank you.